My name is Dr. Bruce Viagale. I'm a neurologist and stroke expert at the UCLA Medical Center.
My name is Kate Adamson, and I'm a stroke survivor.
My name is Mario Garden, and I'm a stroke survivor.
I'm Dan Mountain, and I'm a stroke survivor.
Stroke is the third leading cause of death and the #1 cause of long-term disability in the United States. As a stroke survivor or a caregiver for a stroke survivor, did you know that having a stroke puts you at a greater risk for a recurrent stroke?
750,000 Americans experience a stroke every year.
At least 1 in 4 will experience another stroke within their lifetime.
Within 5 years of a stroke, 24% of women and 42% of men will experience a recurrent stroke.
Recurrent strokes have a higher rate of death and disability than first strokes, but there is so much you can do. That's why National Stroke Association has partnered with the Bristol-Myers Squibb Sanofi Pharmaceutical Partnership to develop the STARS program.
STARS.
Steps Against Recurrent Stroke.
STARS is a program to make sure you know how to reduce your risk for recurrent stroke. By improving your health, diet, and physical condition, you can avoid having another stroke or brain attack.
Keep your blood pressure and cholesterol levels under control.
If you smoke, quit now.
Start an exercise program.
Eat as healthy as you can.
Make sure you talk with your doctor about the medicines that can help protect you against another stroke. It's important to continue taking the medications your doctor prescribes even if you feel fine. Blood clots restricting blood flow in the brain's arteries cause the majority of all strokes. There are medications that will help keep blood platelets from sticking together and forming clots, so discuss these options with your doctor. If you have an irregular heartbeat, a condition called AF or atrial fibrillation, work with your doctor to control it. And if you have diabetes, take active steps to keep it in check.
If you take the steps to improve your health, you'll greatly reduce your risk of another stroke.
Take care of yourself.
Do the things you need to do.
You can avoid having another stroke.
Recurrent strokes are very common in stroke survivors, so National Stroke Association wants you, your caregiver, your family, and friends to know the signs of having a stroke.
It is very important to recognize when someone's experiencing a stroke. Here is a fast way to remember the most common stroke symptoms.
F is for face.
Ask a person to smile. Does their face droop?
A is for arms.
Ask a person to hold out both arms. Does one arm drift downward?
S is for speech.
Ask a person to repeat a simple sentence. Is their speech slurred? Are their words mixed up?
T is for time.
If the person experiences any one of these symptoms, call 911 immediately.
Remember the FAST system of recognizing when someone is having a stroke. It can help you get the person to a stroke center hospital immediately and possibly save their life. You can find your nearest stroke center hospital on the National Stroke Association website. Go to stroke.org and click on the Emergency Stroke Center Locations button. Be proactive in the fight against stroke. Be able to recognize when someone is having a stroke. And if you've already had a stroke, know that taking care of yourself through eating right, exercising, partnering with your doctor, and taking the medications prescribed can help you prevent having a recurrent stroke.
Do the things you need to do.
Be a stroke smart star.
You can be a stroke smart star.
You can be a stroke smart star.
You can be a stroke smart star.
For a pamphlet and more information on the STARS program, contact National Stroke Association at 1-800-STROKES or log on to our website at stroke.org and click on the STARS button on the homepage.